11 more Manitobans have died from COVID-19, according to provincial numbers, bringing the total deaths in the province to 1,847. Manitoba announcing 11 long-term care home outbreaks between May 1st and 7th, as well as 196 new hospital admissions, 13 of those requiring the ICU. One ICU patient was under the age of 10.
Hospitals are really full. They're over full, in fact, at this point, and we're certainly starting to hear stories about patients having to be placed into areas that are not traditionally being used as patient areas.
Dr. Philip Lagacy-Weens says there's a lot of COVID-19 factors at play, creating a crisis in hospitals, but outside of healthcare, Manitobans we spoke to are spending less time thinking about the current pandemic.
I have not put a lot of thought into it recently.
You think about it a lot a few months ago, but now with mask mandates gone and with a lot of people vaccinated and things reopening, kind of forget about it a lot of the time.
I would say I do, but obviously it's getting less and less as time goes on.
Dr. Lagacy-Weens says that's understandable with pandemic fatigue, but the fight's not over. According to the province, as of April 30th, 42.8% of Manitobans had received one booster dose of the vaccine, but Lagacy-Weens would like to see that increase and see fourth doses made available for all Manitoban adults, much like Quebec has done.
We're sitting on a treasure trove of vaccine. We are staggeringly slow with our uptake of third doses. I think we should be on track to offer the fourth dose, a booster dose, 6 months after your last dose to pretty well everybody.
Currently, Manitoba is following the National Advisory Council on Immunization's recommendations, allowing only elderly Manitobans to be eligible for the second booster. This week marks 6 months since Manitoba made the first booster available to all Manitobans 18 and older, and the second booster has been on the minds of many.
I looked into that, and if I was eligible, I would take it.
Yeah.
And I've had my 4 doses, so
Yeah.
already.
And then would you suggest that other people look into getting
I think that's a wise thing to do, is to take all the precautions that you can absolutely take.
Still deciding on that one.
I guess, yes, if they were required.
Yeah, but just if it was available and just optional, you might not want to.
Not right away for sure. I'll probably get all the boosters that are allowed, but that's my personal opinion.
I'm all for both decisions, so I've got my 2 and probably plan on sticking with that.
100%. I got my first booster as soon as I could, and I think I'll get my second one as soon as I'm eligible. It's just the right choice.
The province says no decision has yet been made on changing fourth dose eligibility in Manitoba. In Winnipeg, Mike Albanese, City News.